Welcome to another edition of Inside Medicine. I'm your host, Doug Geinzer, the CEO of Las Vegas HEALS. HEALS being an acronym for Health, Education, Advocacy, and Leadership of Southern Nevada. We're here in the studio today with Zack, the president and CEO of Easterseals Nevada, and we're going to get to know her in just a few minutes. If you're new to joining us here on Inside Medicine, we broadcast live in the studio every Thursday at 10 a.m. If you do happen to miss it, which you should not, you could catch us on YouTube, you could catch us on our website, and a whole list of other places such as Stitcher, Spotify, iTunes, Roku. Look around, you'll find us. But we like to bring in leaders of healthcare here in Southern Nevada into the studio to find out what they're doing, what they're up to, and what they're doing to contribute to the improvement of the quality of health right here in Southern Nevada. We like to bring in leaders in the space of medical tourism, medical education, sports medicine, and today we're going to talk to you a little bit about Easterseals. So, Christine, welcome to the studio.
Thanks, Doug. It's great to be here this morning.
Yeah, so before we dive into Easterseals, because I know you have one heck of a story to tell us, our audience wants to get to know you. You and I have known each other for several years. You came to Las Vegas, and what brought you to Las Vegas?
For approximately 15 years, I was in the for-profit healthcare sector. I was the chief risk officer for a national for-profit company that owned hospitals, skilled nursing facilities, and some other related healthcare businesses. And I started my career actually as a healthcare attorney. So you can insert the attorney jokes right here. And I started by managing litigation. And so when I moved to Nevada in 2007, it was because I was managing litigation for this national company. I had an office in Baltimore, Maryland, but 50% of the litigation that I was managing was between Nevada, New Mexico, and California. And so
probably more in California, right?
I don't know. It is. I would say that it's a close race between California and Nevada for the litigious nature.
We don't like to hear that, but we know what it's all about with those damn attorneys.
Only some of us.
So why Las Vegas, and do you like it here?
So I moved out here initially to oversee some complex litigation, and it was just supposed to be a short-term stint. Mm-hmm. I was living at the JW Marriott in Summerlin. I lived there for about 3 months, and I remember it was one day in March. I was out on a colleague's boat in Lake Mead, and I looked around, and I remembered the snow back on the ground in Baltimore and said, wow, I can breathe here. This is really where I'm meant to be. I'm not going back to Baltimore. I want to stay here and be based here in Las Vegas. And with McCarran and the accessibility to Baltimore and all the other states and cities where we had facilities, it was really easy to relocate here.
I'm an East Coaster, so it's nice to get out of that weather. I get it. So let's dive into Easterseals of Nevada. So it's known to some, but not known to all. Our audience, we are an audience of healthcare professionals, providers, and those people that are interested in healthcare. So bring that into perspective. Tell us a little bit more about Easterseals of Nevada.
Yeah, absolutely. So we are an independent nonprofit that was formed in 1976 as the Southern Nevada Association for the Handicapped. Eventually, the organization spread statewide and has gone through a couple different names. Right now, there's an affiliation with Easterseals National out of Chicago, but we remain truly independent. And we are a healthcare and human services provider, and over 80% of the services that we provide are healthcare, which was surprising to me when I was talking to a recruiter about this position. I'd been in healthcare since 2007 here, and that had been over a decade, and I never knew about Easterseals, what it did, and certainly did not know that it was involved with healthcare services.
You know, I had an inkling of what Easterseals was about, but until you took the job and reached out and said, hey, Doug, do you know much about Easterseals? And I had to admit that I didn't. It's amazing the work that you're doing. So talk about where your offices are and the population that you serve, because it looks like you're north, you're south, and you serve a couple different populations. So talk a little bit about that.
That's right. So we start at infant. We get some of our patients straight out of the NICU, and we serve all the way through seniors. There are 5 different locations, 2 in Las Vegas. So we have a children's therapy clinic and an adult enrichment services location in Las Vegas. 2 in North Las Vegas. In North Las Vegas, we have adult enrichment and the Adult Career and Capability Enhancement Center. And then up north in Reno, we have a children's therapy clinic.
Cool. So Easterseals is a nonprofit. What does that mean? You know, we're a nonprofit, but there's a difference between a 501c6, which is what Las Vegas Heals is, and a 501c3, I believe, which Easterseals is. So talk to us a little bit about that.
That's right. So the attorney in me could give you the IRS tax law explanation, but I won't bore you with those details. I think we can really simplify that it's a nonprofit business. So we're a corporation. My emphasis is on the business end. And my wonderful CFO who worked at Cleveland Clinic, Lisa Manning, she likes to say that nonprofit doesn't mean no profit. And I think that's a really important distinction. It's really just what we do with our profits that's different. So coming from that 15-year background as an executive at a for-profit company, there are dividends to shareholders, and you don't have that in the nonprofit world. So what does that mean? That means that that margin that we have can be reinvested into our local programs and services and into employee engagement, so recruitment and retention type efforts.
And just for the record, Lisa Manning is a rock star. So I've worked with her before in the past, and she's amazing.
She is. I was very fortunate and I guess persuasive to recruit her to join me less than a month after I joined the
So we're going to dive into your team later on and some of what you've put together. But you took on this role of the president and the CEO. You're an attorney. How did those two collide, and what did that legal background do to prepare you to become the president and CEO of Easterseals?
Well, I'm sure the attorneys in the audience locally don't want to hear this, but it means we save a little money on legal fees because I have a lot of forms already prepared, and I could just go to my my roster of forms that I have already created. But much more than that, obviously the chief risk officer and me, the chief strategy officer and me, these are roles I've played before, all factor into what I do as CEO. But interestingly, I think the thing that has helped the most is that I have maybe a weird connection to marketing. Because I managed litigation for a really long time, I was focused on messaging for juries. And there's a lot of similarities when you walk into an organization and no one knows who you are and what you're doing, and you have this very limited, almost non-existent marketing budget. So I was able to take a look, a deeper dive into what Easterseals does and reframe how we discuss our services and programs, talk about changing program names to more accurately describe it. And it really goes back to that experience with jury messaging, because how do you simplify a description of something that's maybe incredibly complex so that the average person knows what you're talking about, and also so that you come up when there's a Google search done. If you have an infant that has a developmental delay, you're probably not looking for disability services. That's just not a word or a phrase that comes to mind. So we need to think about, for the different services we're providing, what people are looking for when they search the internet. And I credit that strategy, that marketing, with doing jury messaging for so long.
That's pretty cool. And so let's talk about the services that you just mentioned that you offer. And earlier you said that about 80% of the services are health related. So talk to us about your service lines and what your health services look like.
Absolutely. So we provide early intervention services in the home to children that are not hitting their developmental milestones. And that's why we sometimes get patients straight out of the NICU. So we provide physical therapy, occupational therapy, speech language pathology therapy, nutrition, feeding therapy, and then some educational services through early intervention in the home. And that's for children age 0 to 3. At age 3, children age out of the state early intervention program, and that's when they can enter our therapy clinics in Las Vegas or Reno and receive those same services. So this could be a child that was born prematurely, a child that has a simple speech delay, It could be a child with autism or another type of sensory disorder, or something more profound like cerebral palsy.
So it's health services makes up a bulk of it, but then you also provide human services. What's involved in the human service side of it?
So we have both the educational component of early intervention and the educational piece in the therapy clinics. And then on the adult services side, we do have some healthcare services. We have skilled nursing in our adult enrichment services. So that's a day program that's designed for adults with severe physical and intellectual limitations. So it gets them out into a community-based setting. They're able to do an art class or a music class, but then we also have a full-time LPN and a part-time RN so that these adults that need that skilled nursing care during the day are still able to participate. And then taking it sort of a step further, we have adults that have less limitations and might actually be able to launch into a career in the community. And so that's where our Capability and Career Enhancement Center in North Las Vegas comes in. We help to train adults for jobs in the community, and we're very, very excited because we have a partnership that's launching next month with Sephora. Sephora has opened a brand new distribution center in North Las Vegas, and they have partnered exclusively with Easterseals Nevada to provide the training and services to adults with physical and intellectual limitations to get a job out in the community that pays well above minimum wage. And then the final piece of what we do, I call it capability enhancement services. So these, there's two different divisions of it. There are adults that need a home or vehicle modification in order to get a job and to travel to work each day. So maybe they need hand controls on their car. And then separately, we have adults that need a home modification in order to remain in their home so that they don't end up in assisted living or in a skilled nursing facility. And we oversee all of those home and vehicle modification projects in Southern Nevada, some of the rural communities. And I thought until a couple of weeks ago that a lot of our clients were seniors, and I've actually learned that the largest portion of our clients are middle-aged women that have autoimmune diseases, MS being the one that's most prevalent.
That's wild. So you came in, you're the new CEO, you're the new president, you're an attorney. You probably hit some things that you didn't expect. What are some of the challenges that you face as the president of Easterseals?
First and foremost is not knowing what Easterseals Nevada is, and kind of address that a little bit. But we also had this problem internally of not understanding that we were a healthcare organization. We didn't have a compliance program, and well, this is a precondition to accepting Medicaid or Medicare funds. So it's one of the first things I did was to put together a compliance program. And do we hit all 7 of the benchmarks for an effective compliance program? Probably not yet, but we're pretty close. We're probably hitting 5 to 6 of those 7, and we didn't even have a compliance program in December when I arrived. And it's also just hiring the right team. When we talked about Lisa Manning, someone with that healthcare background that understands billing. A huge challenge is we brought billing in-house in March, and I'm very, very proud of the team that just stepped up and figured out how to get it done. But and then along with billing comes with the reimbursement rates in Southern Nevada, having to look at each individual contract and to sit down with commercial insurers and to say, okay, we know this isn't the market rate for physical therapy, so we need to have a discussion about this and we need to revise our contract accordingly. I'm not sure there was that realization before. And I also got a very interesting question. I won't say which health plan it was, but I actually had a health plan say, well, aren't you a nonprofit? Shouldn't you just provide these services for free?
Oh, my.
And I said, would you ever ask Dignity Health that question or Renown? I don't think so. So no, we cannot do it for free. In fact, those I talked to someone who used to run Shriners Hospital in LA, and he was telling me how they used to provide healthcare services for free. It's just impossible to do that. We need to rely on the health plans to give us fair rates on Medicaid, and hopefully we're now enrolling in Medicare as well too, to provide us an appropriate reimbursement rate. And we can do fundraising to help close the gap, but first and foremost, we want to make sure that our revenue from our services covers our overhead.
So you've tackled a lot. You've got a lot going on. Obviously, it's not just you, it's your team. We're going to come back. We're going to talk about that in a few minutes. We're going to take a quick commercial break right now, and we're going to bring some messaging from some of our sponsors. The first one is the Oquendo Center, which is probably one of the finest physical assets right here in Las Vegas that trains surgeons from all around the world that come in every single year. And they train a couple thousand surgeons. And we've been doing a lot of work with the Oquendo Center. They are a key tool to attracting medical meetings right here to Las Vegas, and they want to start talking to the community about hosting some of their events there during their softer days, Monday through Thursday. So right now, let's go ahead and watch a brief message from the Oquendo Center, which will be followed up by our annual gala.
Join Las Vegas Heals as we celebrate the Inspired Excellence in Healthcare Awards on Thursday, October 24th, 2019. Las Vegas Heals will return to the magnificent Four Seasons Hotel to recognize and celebrate 6 more honorees. Be sure to save that date, again, Thursday, October 24th, and be on the lookout for your personal invitation. If you know a physician or healthcare leader worthy of recognition, consider nomination. Nominations open on May 31st. We look forward to seeing everyone at the Inspired Excellence in Healthcare Awards on Thursday, October 24th, 2019.
Welcome back to Inside Medicine. We're here in the studio with our guest, Christine Zack, the president and CEO of Easterseals Nevada. If you just caught some of those commercials, make sure that you have saved the date for our annual Inspired Excellence in Healthcare Awards. It will be held on Thursday, the day before Nevada Day, as usual, over at the Four Seasons Hotel, and we are due to release the list of 6 honorees later on this week, so keep an eye open for that. And welcome back to the studio, Christine.
Thanks, Doug.
And so when we left, we were talking a little bit about the team that you've assembled to tackle this this work that you're doing. You're really bringing a lot of attention to Easterseals Nevada. You mentioned before that in a prior name, it had the word handicap. We know that's not acceptable anymore. Now it's the disabled community. Talk to us a little bit what disabled means.
Well, it's an interesting question. I know there's been this huge disability rights movement, and it's phenomenal. But I think that sometimes it unintentionally excludes others that legally have a disability but aren't using that phrase to describe it. So you can have a disability by birth. You can have a disability by illness or disease, such as MS that we just talked about. You can get a traumatic brain injury from a car accident and have a disability due to that, or they're age-related disabilities. Any senior that's living in a skilled nursing facility has a disability, but not all of those categories of individuals use that same disability language when describing their condition. So I actually like to use the word capability, because I think disability focuses on the negative, while capability focuses on what you can do and what you can achieve.
Very good. And so I'm going to get to talking about your team. You've assembled quite a roster over there, and talk about your team and how they help you accomplish your mission, which is Easterseals' mission.
Absolutely. So, of course, there's Lisa Manning, who we discussed, who has that healthcare background from being with the Cleveland Clinic downtown. I was very fortunate to have Dawn Newberg as the Chief Development Officer when I arrived, who has lived all over the world. Her husband was a gaming executive, and then she's spent time here in Vegas working for Opportunity Village. So she knows the services that we provide and has this global perspective on all the things that we can accomplish from her travels and where she's lived all over the world. One of the things that I've done is to also bring in board members who understand our services and are very supportive. We are so honored that Mike Weldon, who of course was Governor Sandoval's chief of staff.
Mike is one of my favorite people.
He's absolutely incredible. Nevada, for those of you who don't know, Nevada born and raised in Caliente, I think about 45 years with the state. I think he started mowing lawns at a state hospital in Caliente.
I think he was the longest standing Nevada employee ever, and he just retired, 6 months ago or a year ago?
He retired in January. That's right. And he ran the Department of Health and Human Services for over a decade. And when I was interviewing for the Easterseals position, that's actually who I reached out to say, tell me about Easterseals, tell me what you know. And then after he retired from the state, I hit him up again and said, Mike, I need you to come join my board. We really need those high-level contacts in Carson City, and he's just been a phenomenal addition and so helpful. Next week, we'll have our monthly meeting with Richard Whitley at the Department of Health and Human Services, and the credit goes to Mike for making sure that happens. When you rely on Medicaid funding and other state funding, it's important to be able to reach out to the appropriate individuals within the agency if there's an issue.
So who else do you have on the board?
So Senior Judge Charles McGee from up north, who's the founder.
I know Judge McGee. He's a character.
He is. And he's also another born and raised Northern Nevada. And I think his dad was the first FBI director for the state.
Oh, my gosh.
But he's still a senior judge. He was always a family law judge, and he founded the Children's Cabinet. His wife is very involved with early reading for children, and they're helping to get launched a reading program in our Reno Therapy Clinic. Nice. And he was I think I said he's a founding member of the Children's Cabinet and a couple other children's nonprofits. So it's been really great to have him on board. We have Sarah Partita, who's used to be actually where Mike Weldon is now with Richard Perkins and the Perkins Company, but she was a lobbyist. She's now an attorney at Wynn Las Vegas, and she also worked for the state and has a really strong knowledge about healthcare in the state and about Easterseals. We have this long list of people. Nicole Rourke, who was basically in charge of government affairs for Clark County School District. So you hit that education piece. I know I'm missing a lot of people. Dr. Mario Gaspar, he is our most prominent board certified. I think he's a pediatric developmental behavioral specialist, the only one in the state. He does autism diagnosis in our children's therapy clinic for children, typically in that 0 to 3 age range.
So you've built this rock star list of your board, but you still need community engagement. Walk us through that. How can the community get more engaged? How people see what your mission is and they want to help? How do they go about doing that? You've got a bunch of events coming up. You're looking for volunteers regularly. Tell us a little bit more about how the community can engage with you.
So I think first is go to our website, read about our programs and services, see what interests you. And if your interests are children, for example, then we would love to have you come volunteer in the therapy clinic. We have play groups, which is really important to have children with developmental delays, with children that don't have those delays, sort of an inclusive play group. There's opportunities to read. There's our children's fashion show, which we just had in May, the inaugural one. It was a huge hit at Fashion Show Mall. And then if maybe you're more interested in adult services, then there are opportunities to come to our Adult Enrichment Services Center or to the Capability and Career Enhancement Center. If you want to commit financially, then again, you can go on our website. You'll see that we do not rely on fundraising to cover our overhead. However, because our margin is not that large, we do rely on fundraising to expand programs. We would like to relaunch our autism services program, and we need money to do that. And we also have a really old state building on government land on Oki that we need to tear down part of it and construct a new building and then rebuild the back building. So we are going to be kicking off a capital campaign probably this fall to get that
Close
done.
the Gap? Is that a program or is that a different one?
So Close the Gap's a little bit different. Close the Gap is really about the reimbursement rates here, particularly in Southern Nevada for therapy services, and the amount it actually costs to provide that service. So speech therapy is the one that I like to use because it is needed by the most number of people, both nationally and here locally. We have over 600 children currently in early intervention, and over 500 of those children need speech therapy services. The Medicaid reimbursement rate, we'll just round it up to about $64 per session. If ideally you'd want to do an hour session. However, the current cost for a speech language pathologist is anywhere from $80 to $90 per session. And so you've either got to figure out other ways to cover that, or you don't give that child a full hour session. And the commercial rates really aren't much better. It's very tiny percentage.
We fight that every single day.
Yeah, I can tell you the Department of Health and Human Services was stunned to hear that there were commercial insurers on PPO plans that are paying less than Medicaid as a reimbursement rate for therapy.
It's a crime.
Yeah, and when you think about it, it's children, right? So these are kids, and it's preventive health care. If you can get a child that speech therapy, that PT, that OT that they need in early intervention, they will never need that service again. So you're saving money overall, but you've got to pour some money into it up front when they're young so that they don't need the service later. So it's preventive healthcare at its finest, and yet the service they need most is the one that is the most under reimbursed across the board. So Close the Gap is help us pay for that difference so that we're not borrowing from other programs to cover speech therapy. At our children's fashion show, we actually honored Dr. Lois Tarkanian, which everyone knows her from the city council or as Jerry Tarkanian's wife. What a lot of people don't know is that she is a speech language pathologist.
I didn't know that.
Yeah, she worked at a school for the deaf in California, and I think also at a school here when she first moved to Nevada. So she kind of epitomizes the work that we do.
And you've got a couple events coming up in October, I believe. You've got Block Party, and then you've got Great Inflatable Race. Tell us a little bit about each one of those.
Yeah, so Block Party is an event at the district in Green Valley, and it's been around for a long time, but it had a different name. It had the name of Cheers for Chocolate. And when I asked our chief development officer to describe the event, I was like, well, that sounds like the block parties I went to back in Pennsylvania growing up. That doesn't sound like it's chocolate focused. It's beer and wine and entertainment and music. And I think they have a character artist and maybe tarot card reading. So it's a big, fun block party. So that is on Saturday, October 5th. At the district, you can buy tickets online. There's sponsorship packages online, or Dawn Newberg's information is on our website. Reach out to her directly to see how you can help support our event.
How about the Great Inflatable Race? It's a couple weeks after, I believe, October 19th?
That sounds right.
Okay.
So this is a brand new event for us. We're really excited. We were chosen as the partner. So I guess, instead of doing one of these crazy races where you can get shocked or, run through the mud, this is one where you go through inflatable obstacle courses along the way. And one of the cool things that we're working on is that we're hoping to get some of our patients and clients to participate in the race, or maybe have a little mini race for them after the main race gets started.
And of course, the most important one that you have coming up is co-sponsoring a Las Vegas Heels Healthcare Happy Hour next week on Tuesday. It's going to be over at Blue Heron Homes. I believe we have a little bit of information on that.
Yes. So we are going to focus on the services we offer for children at that event. And we're very excited that we were invited to the Blue Heron event, as I understand that everyone wants to come see the beautiful home in Southern Highlands. So we're looking forward to showing off a little bit about what we do for kids at Blue Heron next Tuesday.
So I hate to do this. We've got to bring the episode to a close. We're at that 30-minute mark. Is there anything that we missed that you wish we touched on? And we've got maybe 30 seconds.
If you want to make a donation to Easterseals Nevada, please go visit our website, eastersealsnv.org, and just pay attention when you're making donations in general to nonprofits to make sure it's staying locally and not going to a national affiliate that isn't providing programs and services in your local community.
Christine, thank you for joining us. It was wonderful to learn more about Easterseals Nevada, and we'll have to have you on the show again. And for those that are just checking us out, come to our event next Tuesday, and you can learn a little bit more about Easterseals as well as Las Vegas Heels and our other co-sponsors. Until next Thursday, we will see you then.